Hello everyone. Now I am going to tell you about one important condition, that is a scarlet fever. And what is even more important is that its association with rheumatic fever and post-streptococcal glomerulonephritis, which I will be explaining it to you. Now, what is a scarlet fever and what is it caused by? The scarlet fever is caused by group A beta hemolytic streptococci, that is the streptococci pyogenes. And how does it present? It will the most three important conditions, that is it will be presenting with strawberry tongue, and it will be presenting with red lips, fever, as well as maculopapular rash. So, these are the important associations, important presentation of scarlet fever. Along with the fever, they will be having all these. Now, what is the treatment for streptococci pyogenes? When streptococci pyogenes is attacked, the streptococci pyogenes is susceptible to penicillin. So, we treat the scarlet fever with the penicillin, so that the scarlet fever condition is we get rid of it, we resolve from it, and we also prevent the rheumatic fever. So, what is the association between scarlet fever and rheumatic fever? So, the streptococci pyogenes is the common organism. Here the organism producing the condition is this, but when the antibodies which are formed against streptococci pyogenes, when it mistakenly attacks the heart valves, then it can result in rheumatic fever and cause rheumatic heart disease. So, this is the association between scarlet fever and rheumatic fever. So, when we give penicillin, the streptococci pyogenes is eradicated. Now, the body need not produce antibody against streptococci pyogenes, and that antibody need not cross react with the heart valves and resulting in rheumatic heart disease. So, therefore, the rheumatic heart disease is prevented with this antibiotic. But my second question is, can post-streptococcal glomerulonephritis be prevented if penicillin is given? For that, you need to understand why post-streptococcal glomerulonephritis occurs in the first place. The post-streptococcal glomerulonephritis is because of type 3 hypersensitivity, which is because of immune complex deposition. That means the immune complex, that is the antigen which is produced by the streptococci pyogenes, is present in the blood, and the antibodies will cross react with the antigen which is present in the blood. This antigen against that antigen antibody complex form, that is known as an immune complex, that will get deposited in the kidneys, resulting in post streptococcal glomerulonephritis. That's what we should know. So, even if the antibiotics are given and even if the infection has been cleared off, there is some amount of antigen which is secreted by streptococci pyogenes. That antigen will react to the antibodies, and that will form immune complex, and that can result in post-streptococcal glomerulonephritis. And we cannot prevent post-streptococcal glomerulonephritis with the penicillin because of this condition, because of this mechanism. Thank you for listening all this while. I hope I made things clear to you. Have a good day.